Hi, good evening, everybody. So my name is Marika. For those who know me don't know me by now, because loads of people joined the group since last week. I'm the physiotherapist from sportsinjuryphysio.com, where you can get online physiotherapy treatment. Now, I see loads of people are joining us already. Hi, Amy. Glad you can join us. So tonight I've got my colleague Ali on to tell us about how to avoid hi Ali, how to avoid tendon pain while running. And we started another online service that is focused around Achilles tendinitis, Achilles tendinopathy, whatever you call it, or prefer to call it, and where we treat it online actually via video calls. But we are both firm believers that prevention is better than cure. So that's why Ali is here to explain to you why people get this condition and how you can avoid it. Now, I know loads of you who've joined the group already has Achilles tendon pain at the moment. So I did a live stream last month about what you can do if you've got Achilles pain. And I will repost that video in the group tomorrow. But feel free, how this works, if you've got any questions, ask them in the comments. I will keep an eye on it. Hi, Jan. And I will relate them back to Ali as they come in. We may leave them for later in the video to answer so that I don't interrupt Ali too much. But yes, and if you're watching this on replay, feel free to ask them in the comments and just make sure that you tag either me or Ali so that we don't miss them, that we know that we've got to go and look at what you've asked. Perfect. So Ali, if you want to introduce yourself and just tell the people about who you are and what you do.
Sure. Hi, this is my very first Facebook Live, so it's quite nerve-wracking, and thank you for inviting me. The plan today is to talk through preventing Achilles pain in runners, but before we go into that, I just wanted to let you know who I am, and I am a chartered physio that's worked with Marika, I think, for probably about 8 years or so now, and we work together clinically, and we also have, as Marika just said, set up treatmyachilles.com. So my plan today, I've got a lovely set of bullet points, which I think Marika is
There we go. It's there.
Is to run through these different sections. So we've got the section on what is the Achilles tendon and how does it work when I run. And the idea of that is that's the introduction to let everybody know that we're on the same page when we're talking about what you think we're talking about. We then go moving on to exercises to prevent Achilles pain, common training errors and how to avoid them. Are rest and sleep important, and do I need to change my running style? And as Marika said, if anything comes up and you've got any queries or questions, please just type away as we're going through. So starting with the first one, what is the Achilles tendon? So the Achilles tendon is the big strap tendon that runs at the back of the heel and it joins up to the calf muscles. And those big calf muscles, there are two different ones. There is your gastrocnemius and there are your soleus muscles. They come down into that Achilles tendon, and what it does is point your toes. So that's called plantar flexion. But in running, it's involved in the pushing off bit, the propulsive part. And it acts a little bit like a spring. So it stores the energy, and then as you push off, it releases that energy quite quickly. So if we looked at the Achilles tendon under a microscope, what you'll see is it's made up of lots and lots of collagen fibers in a long, long line. And those collagen fibers aren't just one at a time, they're in little bundles. So if you think about getting a piece of string, if you put 5 or 6 pieces of string together and try to pull it, it's going to be a lot stronger than if you had one piece of string. So it's made up in these different bundles. It's all in a nice linear line and it's nice and healthy. And how our body keeps it nice and healthy is through a process called collagen synthesis. So what that means is that without even of us knowing about it, our body is continually replenishing those collagen fibers and removing all the products that we don't need. Now that cycle has a set start time and a finish time, and it's on a loop. If what we're doing for running outstrips that cycle, so let's say the intensity goes suddenly quite high or the amount of the volume goes suddenly quite high, then what we might be doing is loading that tendon too much for how robust it is, and that might lead you on to having more likelihood of Achilles tendon problems. And those sorts of Achilles tendon problems would be your tendinitis, your tendinopathy, your tendinosis, and they're the ongoing types of Achilles pain, which we're basically talking about today. There are a whole other set of Achilles injuries, and they would be more of a sudden onset, so an acute pain that happens straight away, and they can be indicative of a tear. And sometimes they can accompany a feeling of like a gunshot or a kick in the back of the leg. And if you were to get those symptoms, that's when you would need to go and see a health professional. and go quite quickly, so you could gain the right sort of advice on what rehabilitation to do and how that can get better. So for the purposes of today, we're focusing really on the ongoing type of Achilles tendon problems, but some of which we're talking about is relevant to both types. So we've mentioned that the Achilles goes up into the calf, and those calf has two different muscles. What you also have is a set of other muscles that are involved in running. So if Marika sticks up my lovely man that's got no skin on him.
There we go, it's there.
See some muscles that we use for running. Now, notice the word some, this is not an exhaustive list, but when we look at the research about preventing injury and preventing Achilles tendinitis and tendinosis, you're looking at the strength of these particular muscle groups that come up time and time again in the research. So they work together a bit like a chain. You've got the calf at the back leading to the Achilles, as we said, and above that on the back of the thigh, the hamstrings, the front is the quadriceps, and in your glutes, there are two of the three that we're focusing on, glute med and glute max. Now, let's say you had weakness of one of these types of muscle groups or an injury in one of these type of muscle groups and you were compensating for it. That could change the load that then goes through the rest of that chain, and that again could lead on to developing an Achilles tendon problem. So there is some research out there to show that if your glutes, for example, are quite weak, you are more likely to get an Achilles tendon problem than somebody that may not have weak glutes. So this very nicely leads on to our bullet point of exercises to prevent Achilles pain. So it's not just about strengthening the calf. And you've probably looked, if you've got an Achilles problem or looked at trying to prevent it before online and seen loads of calf strengthening exercises. And they tend to lend themselves to both your gastrocnemius and your soleus. So if you were biasing those, your gastrocnemius, you would tend to find exercises that you were doing a calf raise with a straight leg, and the soleus ones, you would be doing ones with more bent leg exercises. That's as much detail as I'm going to go into for specific exercises today, because for individuals, these types of exercises need to be really individually prescribed. And it's not just about the calf, it's also looking at your hamstring strength, the quad strength, and those glute strength.
And it's, if I can interrupt you, Ali, so there was a comment yesterday in the group about somebody who said that he did loads of calf raises to try and help his Achilles pain, because let's face it, when you read on the internet, that's the main thing that people say, you do the heel raises to do that. And he actually found that they killed off his calves. And that's a good example of whatever dosage he was doing, and it may have been what people told him to do, it was just too much. Yeah. Because we're all different and we all start from a different starting point.
Exactly.
And I know we both tend to kind of prescribe anything from double heel raises to single heel raises with weights on the back, depending on the person. And some people will start with a one.
Yeah. Yeah, absolutely. Sorry to interrupt you.
No, that's fine. So yeah, coming to strengthening the rest of the body to prevent Achilles pain, that's exactly the same thing.
And it is, like you were just saying, I was coming on to thinking about more about where we all start and where we all go to and why it needs to be completely individualized. If we think about what we do in a clinic setting or on Treat My Achilles when we are subjectively asking questions, so that's the first part of an examination where someone's having a question and answer session. What you're looking for is prompts about where that person is at that starting. So that starting point could relate to lifestyle, for example. It could relate to the jobs that you're doing, whether you're on your feet all day, whether you're quite sedentary, whether you're doing quite manual jobs. It could relate to other sports and other interests that you like to do on top of running. The amount of mileage, the goals in the running, are you going to be progressively increasing the amount of running to get to an end point like a marathon or an ultra marathon, or indeed the park run on a Sunday? And again, you can see that all of these have a different end point and a different starting point. Health is really important, and whether you're taking certain medications can have an impact on how strong you might be, or side effects relating to things like Achilles tendinopathy, so they're important to ask. So that's why we just don't come in with a recipe and give absolutely everybody 3 sets of 10 of all of these different exercises and expect you to cope with it. It needs to be something that's been prescribed by a health professional or an exercise professional. But the things that we really need to think about is all of those different muscle groups and looking at each of one of those and seeing how strong you are already. Now, the good points that everybody can take away from this about strengthening exercises is that they have been the most common thing about injury prevention, not just Achilles pain, but for runners. And this is the most thought through sort of research papers that are coming out at the moment for injury prevention. You're looking at trying to fit strength training in at least twice a week, preferably 3 times. And by strength training, we're talking about when you have finished those sets and repetitions, so the amount of times that you're doing those exercises, you are completely and utterly tired out in that, well, that muscle is completely and utterly tired out. So if we were to say, do a couple more repetitions of that exercise, you would find that really difficult to do. And you would find that difficult to do for both it's tired, but also the quality of that exercise.
Okay, so that's how you can know whether your strength training is actually strong enough.
Yes. Yeah, and it's important to get the strength adaptation that your body needs to get stronger. So if you were not to work to fatigue, you're just keeping it quite happily at the level that it is now. And what we need to do to prevent injury is keep making it robust and keep making it strong and making sure everything is strong in that chain so you are less likely to injure your Achilles. We're talking about those sets and reps being to fatigue. We're talking about doing those 2 to 3 times a week. So if you're looking at this and your weekly program of when you go running and when you do other activities, a really good time to fit your strengthening exercises in would be on a rest day. So a day where you aren't really doing any running whatsoever, or really any lot of load. So by load, lots of activity that you're doing that day. If there isn't such a day that doesn't fit in with your timetable, and you might then want to try and fit it in with a day where it's of lower load, so a lesser run, a not very high intensity or not very high mileage run. And if you could do that, you may split it. So you might do strength and conditioning in the morning, for example, and a run in the afternoon, or you might flip it around and see what you could fit in that way.
Ali, can you maybe just point out why it's important to look at the total load in the day, that you don't do the strength training on hard training days?
Yeah, absolutely. What we're looking at is, well, this kind of comes onto my training error area. We'll onto that in a minute, and I've got a nice diagram to do that. But if you look at an Achilles tendon problem, which is really common when we're treating people on treat my Achilles or also in a clinic situation, they tell us that they've been doing all of these exercises and they're not getting any better. Well, it might be that nobody's looked at the overall load side to it. And it's about then, it's like pressing on a bruise. If you do too much in one day and you're pressing on that bruise, and then you start doing your exercises on top of that, you're not really going to cope with that. You're not going to get your strengthening adaptation. You're not going to make anything more robust or strong. If you have the chance to have the separate side to it, so on a lower intensity day, you're going to get that strength adaptation. You're not going to be pressing on that bruise, so that pain doesn't increase, and then you can calm that back down and get the best of both worlds. And I'll come on to that a little bit more.
Perfect.
Is that all right?
Yes.
So that's kind of my strength stuff in a nutshell. 2 or 3 times a week. Do it until you can't do it anymore, and gain advice on which muscle groups you're weak at and fit them all in. So this has massively changed in the 19 years I've been a physio. Even if you rewind back, we've been probably prescribing stretches longer than we've ever been prescribing strengthening exercises to fatigue. And we were telling people when they came into clinic, particularly runners with tight, let's say hip flexors or glutes or calves, to stretch and keep stretching and keep stretching. And now we have to ask ourselves, well, why were they tight? Well, why were they tight in the first place? Yeah. And they could be tight because they're weak. They could be tight because there's injury. They could be tight because they're compensating for an injury. They could be tight for many different reasons. But quite a few of those reasons go back to the strength exercises. So if you solve the strength problem, you actually solve some of the tightness problem. So again, when you look at the research for stretching and injury prevention for Achilles pain, stretching for stretching's sake, there is just not worth it. Just don't do it. If you were thinking about what you could do and when stretching is appropriate, then it is really appropriate for a warm-up situation for injury prevention. And that sort of warm-up would incorporate both static and dynamic stretches. So that I mean, a static stretch is something that you would hold, and you hold for a period of time, and the dynamic stretch is more movement-based. So your static stretch, you're looking at trying to hold it for between 30 and 40 seconds. The reason why we've got that time scale is that before 30 seconds, you're not really going to get that range of movement change that you're looking for. And after 40 seconds, 45 seconds in the research, it's showing that you may actually have a change in your running performance. So it's getting that sweet spot between 30 and 40 seconds. It's stretching out those different muscle groups that we've spoken to in running. And I'm sure that's something that Marika's either done a blog on before or something we can do again about static stretches and which muscle groups and what they might look like.
Yes, yes.
So you've got your stretching exercises, you've held them, and then you would move on to your dynamic movements. So you've got your range of movement change, and you're starting to increase that circulation into those soft tissue and those muscles. But also when you're doing dynamic warm-up movements, you're increasing the synovial fluid, which is your body's lubricant, into those joints, and you're getting that circulation going, ready for preparation for activity. So really great dynamic warm-up movements, particularly for a calf or an Achilles, might be a few heel raises, it might be walking on your tiptoes, walking on your heels. You might also find like a backward stepping lunge, quite a lovely dynamic warm-up movement, because if you think about what a lunge looks like, it's a really exaggerated running position. You might try kicking your heels to your bottom, doing leg swings. So really it's thinking through the joints that are involved in running and what movements they do. So your hip flexes and extends, so it bends and straightens. So does your knee, so does the ankle, and so do the toes. So it's finding the movements that replicate that. This only needs to be 3 or 4 minutes. It doesn't need to be very long at all, because again, when we're looking at injury prevention, if you were to go too much on the dynamic warm-up, you're actually fatiguing yourself. And if you then go back out and run on top of a fatigued set of muscles, you're more likely to injure yourself and get an Achilles problem.
Yeah, and I guess that comes back again to the right level of dynamic warm-up, even for the level you're at. Because
Yes.
if you think of, I've watched at some of the athletics things I've worked at, the summer athletics last year in London.
Mm-hmm.
I just looked at the athletes warming up for beforehand, and it was knackering. If I did what they did just to warm up before they even start running, I
Yeah.
would have died. So a warm up can mean a very different thing per person. And if your warm up is too intense, you can actually knacker your Achilles, like Ali has said, before you even get going.
So again, for prevention's sake, it's getting that sweet spot, and again, getting advice. And there may be running coaches out there. There may be other people in your running groups that could offer that, as well as health professionals. If you've got niggles and injuries, it's worth checking. Once you've run and you've come home, the best way to cool down would be your static stretches again, so those 30 to 40 second holds, and you kind of keep going with those to keep your range of movement and try to restore that. Again, there's no need to do that as and when, it's just when you return. So we've talked about strength exercises are the main thing about injury prevention, and then warming up and cooling down and not worrying about stretching too much. That's kind of my exercise section in a bit of a nutshell. Is there anything else you wanted to go through, Marika, or anything you thought about?
No, that sounds pretty good. There are some questions coming in, but I think we'll answer them at the end.
Okay.
So Andrea, I'm seeing your question. I'll get to that in the end there. There's quite a few people saying they get lower back pain with their Achilles pain as well. So we may want to talk about that at the end.
Yeah, remind me of that, or
yeah.
I can remind me. So if you move on to the next section is common training errors and how to avoid them. So if we look at the two main things that we're looking for with an Achilles preventional program, it is how strong and robust that calf is, how strong and robust that Achilles tendon is, and the chain. But the other side is how you're actually running and what's your running program. Are you doing too much too soon? And a really nice diagram to illustrate this is the one with the managing load.
We've got them there.
There we go. And this is taken from a running repairs course run by Tom Boone, who's known as the running physio. And what this does is look at what our sweet spot is. That sweet spot is in the middle, called the strengthening zone. And that's the zone that we need to find to work out when you can train, when you can strengthen. So at one end, you've got a man lying on a couch even, which is when your tissue is completely underloaded and you're not doing anything. So it's not very robust, it's not very strong. And at the other end, we've got somebody carrying an elephant. So that's far too much, it's overloaded. right at the beginning, we talked about that collagen cycle. So that cycle of our body laying down collagen fibers and removing the waste products. Now, if we were underloaded, and that is not a particularly great cycle, and you haven't got a very robust tendon, or if you're overloading it, so that cycle can't keep up with the amount of intensity or volume that you're working at, then you're not working in that sweet spot. You are then likely to get an Achilles tendon problem. So how we would find that sweet spot is lots of questions and checking that strength exercises. But how you can find that sweet spot is by looking at a few different training areas and seeing whether you are doing any of those. And we're going to talk about training intensity. We're going to talk about training volume. We're going to talk about when you put your running days in your week and can you change that? Mm-hmm. And this sort of links onto the rest and sleep section that we've got on another bullet point. So if we were to talk about overuse injuries, training errors, so Achilles tendinitis, training errors can account for 80% of these injuries. So it is really, really high and really important to look at this. So when you're looking at your intensity of your runs, you're looking at your weekly intensity being about 80% low intensity and about 20% high intensity. So what do I mean by that? I mean that your low intensity runs are your continuous, similar speed, longer mileage type runs, and the 20% being the high intensity, being more your tempo run, hills, interval training, stuff that's really quite hard work, but in short bursts of time. Now, this is where we come on to talk about this load part that Marika mentioned earlier. So load fits in with all of the things that you do in that day. So if the other sports you like to do are high intensity, that's included in that 20%. If all the things you like to do means that you're on your feet all day and you're doing a manual job, that will come to play with the rest section that we're talking about. So everybody is slightly different, and that's where if you speak to a professional when you've got an injury, we'll be able to help you load manage. Because one of the sections when we're treating somebody would be to give them strengthening exercises, but also look at that whole package of that activity that you're doing and trying to keep you running as much as possible, but we might remove some of those most aggravating factors so that you can still keep training, you're still getting that training stimulus, but we're actually strengthening that Achilles and making that strengthening zone on that picture that we just looked at a little bit bigger and a little bit more robust. So if we're looking at this 80% and 20%, right, well, that's great. How do I work that out? If you're looking over what you've done for the last few weeks, and you might look what you've done for the next few weeks, if you simply add up either your mileage or you add up the number of minutes of the exercises that you've been doing at high intensity and low intensity, does that work out if you work your percentages out at about 80 to 20? That's one way of doing it. Bearing in mind, life is always throwing us a curveball. Sometimes you get poorly and you're in bed for a week. Sometimes you're on holiday. Sometimes you have a lovely event with friends and you go out and you do a lot more than what you're supposed to be doing at a weekend. That's fine. That's life. We're talking about a general trend of it being about 80 to 20. And how you can rate and work out how hard you're actually working. Well, there's wonderful equipment out there that you might be wearing, chest straps to measure heart rate monitors. You might have various different watch-based measurement devices that you can check how much you're working on. Notice I'm trying not to say names about which one. What you can also do is use something really simple called the rate of perceived exertion, which I've also got on a slide somewhere.
Yeah, we've got it up there.
Wonderful. And as you can see, it sounds quite fancy, my rate of perceived exertion, but really it's a score out of 10 about how hard you're working. So 0 is I'm sitting still, not doing anything, and 10 is, oh my goodness, I am trying the hardest I possibly can. I cannot speak. I'm absolutely shattered. And when we're looking at trying to get that 80-20 split, what we should be looking, according to research, is that between 1 to 4, that is where 80% of your runs comes in. So that's your continuous running where you can do anything other than complete rest, as it says. You can feel like you can maintain it for hours and that you can have a good conversation. So when you are doing your longer runs and you're thinking, is that in my 80%? In your mind's eye, think, am I around that sort of level? And that gives you a good idea that you're working at that lower intensity. When you're looking more at tempo runs, which comes into our middle section, the research says unbelievably between 4 and 6.5. Now, I'm not massively sure how you work out what's a 6 and what's a 6.5 and what's a 7, but that's a research paper versus real life. When you were looking at it, it's around about the 4 to 7 category. So that's when you're exercising, but you could hold a few sentence conversations, you're slightly short of breath, but it's still quite easy to do. And again, it says so on the whichever way the slide is. I'm not really sure which way I'm pointing the slide. If you look at that, that's where your 12% of your runs come in. So actually a tempo type run. Again, 12% is the guideline from the research paper. This is a bit give and take. It's around about that. When you come onto hill reps and you're looking at your interval training and your speed work, now this is the time where you're mostly on your toes, you're mostly in that propulsive category. So that's the category that we were talking about, which works that Achilles quite hard. And that's something when we're talking about the load management that we might look at with people with Achilles tendon problems, it might be the first thing we start to say, oh, maybe we could play around with that side of it a little bit and keep you running with more of a lower intensity to take that load away from that Achilles in your calf. If you haven't got an Achilles tendon problem and your calf is pretty robust and nice and strong and can cope with those sorts of activities, there's no reason to stop them, and actually they can be quite beneficial with your training. But this works out to about 8% of your runs. So again, if you read the descriptions from 8 to 10, this is really difficult to speak more than a word, to have a conversation, and you're working quite hard. So again, does this help? What we're looking at is count how many miles, count how many minutes you're working within the last few weeks and the next few weeks. Work out, is it that 80-20 split? Are you working at that right intensity? Have a look at this score, 0 to 10, and give yourself a marker in your mind's eye, and then you know that you're hitting the right spot, and therefore you are less likely to become injured. Another way of looking at this, you can look at heart rate. Heart rate you can measure by using, like we said, a chest strap or something on your wrist. You may not have access to this, and that is absolutely fine to just use that rate of perceived exertion. If you do have access to things like that and you're not sure what sort of heart rate you should be in, there is a great calculator online, and I'm sure there's others, but this one's called the Macmillan calculator. So let's say you're trying to run a particular target time for a half marathon or a marathon. You sit in, I don't know, let's say it's a 4-hour marathon, and it comes up telling you how many minute miles you should be running. It also gives you a rough guide of what that rate of perceived exertion should be, so the RPE, and it also gives you a guide to what your heart rate max, and that's something that you can access for free, and it gives you a bit of an idea about how to work out your intensity.
Oh, cool. So what's that called again, Ali? Sorry?
Macmillan calculator.
Okay, cool.
Yeah, there we go. So that's my first training error, being intensity. My second training error is volume. So quite a lot of people are running a similar level of each week, a similar number of miles, and that's quite steady. But a few people are working towards a particular goal. And if your goal is to start gradually increasing your mileage over a period of time, and that might be quite cyclical, if it's depending on when your event is, that's how you manage that load and how you manage that volume. Now, a lot, and I'm sure most people have heard about the 10% rule, and the 10% rule is looking at your total mileage for the week and going up roughly 10% for the next week. And that's been set in stone for a little while. What you can do to work that out quite nicely, again, is have a look at your last few weeks, have a look at the next few coming up, add your total mileage up. Is it around about 10%? If it isn't, you need to adjust it and see whether you can get it to that point. Now, having said that, there's been a very recent systematic review. Now, that systematic review looked at, so that's a review of all the recent literature around training and volume, and it was looking at whether this 10% rule is relevant or not. And out of that has come a bit of a discussion and possibly some more ideas for more research that's needed. And really, that 10% could be anywhere between 10 and 30%. What we do know is that anything over 30% is more likely to cause an injury problem like a tendinitis or an Achilles, but also other overuse problems that you might get with running. So again, you need to keep a monitor that you're not jumping more than 30% each week. There's been a school of thought to think, well, that's great, 10 to 30%. Well, what does that really mean? And you could have a look at your mileage and what you're trying to progress onto. So if you're running at sort of less than 10 miles, 10% is quite negligible, really. It's not very much that you'd be upping by the next week. So that might be, if you're running less than 10 miles, something that you might increase by 20 to 30%. Let's say you're running a moderate amount, so 10 to 20 miles a week. Well, that's something you might think, oh, okay, I might do about 20, 25%, I might go up. And if you're looking at going to the higher mileage section, you might be thinking, well, actually 10% is just fine, and that's going to work for me because that's quite a significant step, a significant number of miles. Now, remember, this is a weekly thing. This isn't each long run. This is a total number of mileage each week, and it comes back to that load management and managing that sweet spot.
Yeah, and sorry if I can interrupt there.
Yeah,
I guess another important thing to point out there is that it's not just for the mileage, but it's also the intensity. So if you're going to up the mileage by a certain percentage, it's not necessarily the right time to up the intensity as well, because then you're kind of increasing the load from two sides.
Yeah.
So
it's like a science experiment. It's changing one bit at a time, really, or changing both a small amount and seeing how it happens.
Exactly. Yes.
So with a common thing we might see, so let's say somebody's coming now in to see us about an Achilles tendon problem. What's common is if you were to plot your mileage on a graph, because let's face it, loads of people have got lots of time, I quite like doing that, but there's also some things out there that might do that for you. You have your mileage quite high, and then all of a sudden there's a drop. And then you have a rest period, and then you come back running again, and the mileage goes up again, and then there's a drop again. And that's a boom and a bust cycle. And that boom and bust cycle is really common with people with Achilles tendon problems. So you run for a bit, it feels all right, we up it a little bit, ouch, that's sore. So that's like pressing on that bruise again. I keep on running, I'm pressing on the bruise, it's sore, I'll stop. You sit down, you have a rest, you take away some of the running, it starts feeling a little bit better again. It's not actually changed the pathology about what's going on in your tendon, it's just nobody's been pressing on that bruise for a while. So it feels a bit easier. And then off we go running again until it hits that threshold of I can't manage this amount of load you're asking me to do, and then the pain comes back. So this is why looking at this 10% rule or 10 to 30% rule is really, really important. It's about gradually increasing it, but also gradually strengthening those muscles at that same time. So you've got that strength adaptation, you've got that training adaptation, and you're able to progress and move on with that program. So they're my other sections on volume and intensity. But as a side note, you might also want to think about the terrain that you've been on. And if there was a sudden change in the terrain, so let's say it was raining and you went on a treadmill, or you've suddenly done a really nice run with friends, but you've gone over a lot of hills for the weekend, you could look at your elevation. And if you're on something like Strava or other types of apps or websites that measure this sort of thing, you can flip that and you might see again that you've been pretty steady, but there's been a sudden spike in elevation. Well, on hills, you're more likely to be on your toes, you're putting more pressure and load through the Achilles and the calf. So again, it could be a reason why that week may have flared you up compared to another. So it's worth looking a little bit laterally and not just at mileage as well. I'm looking at my notes to make sure I'm not missing anything. And my next section, and my third training area, comes on to your sort of weekly plan about when you're running and when you're not running. Now, some people have got lots of luxury in that, and they can pick different days and have different days off and different things. And other people have really large working weeks or other time pressures where they can't do that and tend to bunch their training all at one end. And that could be typically over a weekend, which would then be called a weekend warrior, for want of a better term. So it's about, can you plan your rest days? Can you plan your rest times? And this leads to are rest and sleep important? You need rest. Our body needs rest because of that collagen synthesis that we talked about before. You need rest to allow that timescale to happen and for those collagen fibers to be replenished. You need rest for adaptations to the training. So if you were to train every single day, your body is likely to not cope with that load and break down. If you have a rest time, your body adapts to that load. So for example, if you were strength training, your muscles get more robust and stronger, and you recruit more fibers, or you lay down more fibers, and you get the hypertrophy of a muscle, and that happens during that rest period of time. If you're running, you also need the endurance stimulus that you get from running, so you need that rest period for your body to adapt to that. So rest is really important, and typically a rest day should come pre a high intensity day and post a high intensity day or a high volume day. So if you're looking at your week, they're the best times to put your rest days in. And as we spoke before, they're great times to put your strength and conditioning times in. Let's say you have only got the weekend. Can you be a bit clever with it? You might be able to, you might not. Could you do a training on a Saturday morning, for example, or a Friday evening, and then rest until the Sunday evening? So you've got a bit of a time in between the two. As you increase the mileage, or you're increasing what you're asking your body to do, your rest levels also need to increase. So your rest and your activity need to be on a par. So how you could manage that is by looking at the times of your training, and this leads us on to sleep. So a normal healthy adult needs about 7 to 9 hours worth of sleep a night. When an athlete is training, like the ones Marika was talking about with the warm-ups, they may need 10 or more hours of sleep a night to recover from what they're doing. So if your mileage is increasing, you need to be really precious about that 7 to 9 hours worth of sleep. So are you training particularly late in the evening or particularly early in the morning? And have you got scope to move those training sessions so you could go to bed just a little bit earlier or wake up just a little bit later? And it may be that you haven't got time and scope to do that, but you might have a bit of time for a nap in the middle of the day. As strange as
Oh, joy. I want that.
Lovely. I fell asleep in the bath on Thursday. Anyway, that's digressing.
That's 2 small children for you.
Yes, that's it. It's a nap of about 20 to 30 minutes being shown to be able to top up and have that recuperation and the stimulus that we're talking about to add into that 7 to 9 hours. Then that for 20 to 30 minutes has been shown to be quite beneficial. So we're looking at, can you change your training times? Can you try and get 7 to 9 hours sleep? Sleep isn't just about preventing injuries. There's lots and lots of other things that relate to sleep. And if you look at your sleep hygiene, are you promoting that 7 to 9 hours sleep? So it's about having a general trend of a regular bedtime. Obviously, things might come up where you've got a night out or whatever, and a general trend of a waking up time being quite similar. And this includes days where you might have the chance to have a lie-in. The research is showing that if you wake up within an hour of your normal wake-up time, that is the best and the best ability to add more sleep in. Your sleep hygiene might be the environment that you're sleeping in. We're talking about the temperature of your room. We're talking about how noisy it is and how dark it is. If you can't control that, you might be able to wear eye masks or earplugs. So, for example, shift workers or people that are in shared accommodation. You may also think about the stimulus that you've had before you go to sleep. So are you using a device with blue light? Could you calm that down within an hour of you going to sleep? Are you taking stimuluses like nicotine or caffeine or alcohol? Again, can you calm that down a couple of hours before you go to sleep? If you have problems tossing and turning and getting to sleep, or waking up in the middle of the night and being awake for hours, there are loads of different things that you can access for free on various apps like Calm or Headspace and other things that you might know about, where there's sleep stories, meditations and relaxations that give you coping strategies on how to do this. So it's promoting sleep, promoting rest, and this is a massive part of injury prevention. So that's my section on training errors. Again, I hope there's if you've got any questions or anything, please keep sending them through. And we move on to the very last bit, which is quite quick, to be fair, of do I need to change my running style? So, you all right? Can I keep going?
Yeah, go for it.
So your running style, that's your gait pattern or your running gait, or whatever you might want to call it. So how's your foot hitting the floor? What position are your knees in? What positions are your hips doing? What are you doing with your arms? Anything like that. And there is big business out there having a look at all this gait analysis. And really, it's a case of if it isn't broken, don't fix it. There isn't one amazing running style. You look at all the gold medalists out there, or the world champions out there, and there's the high stepping gaits that for, I think it's Michael Johnson. You've got the running of some of the female long distance athletes that have got their knees coming quite close together when they're running. You've got Mo Farah that looks like a really great gait and gait cycle, but we all self-optimize. We all have the best gait that we can possibly have for our bodies. So if there isn't an injury and you haven't got a problem, don't worry about it. That's what the evidence is saying for injury prevention. Now, that's very different to your performance of your running. Performance and how you run is a science. It's a great skill to learn. So if you want to improve your performance on how you're running, then you might want to invest in a gait analysis or speak to your running coach and get pointers on how to do it. But you don't need to change it for the sake of injury prevention. So if the only thing, there's a small amount of research out there about injury prevention, and the only thing that was found to be quite useful was the prompt of run quietly. So when you're running, can you think, am I making quite a lot of noise? Can I run more quietly? And if you think about our load that we're talking about through the tendon and through the calf, but also through the rest of our body, if you're running quietly, you're trying to reduce some of that load. You're trying to change your gait to allow for that. And that might be a really useful prompt to have a think about when you're next on a run. There's been lots of research recently talking about, and lots of things in, I'm sure, Runner's World and other magazines about whether you should strike at the rear foot, the midfoot, or the forefoot. And they've looked at all of the injury rates for each of those different ones. And although some of them come hand in hand with different injuries, the actually injury rate is about the same. So there's no need to worry about whether you do one or the other. We've talked about Achilles being more linked to being on your tiptoes and putting more pressure through that calf and the Achilles. Well, if that's what you've always done and you've always been a forefoot loader, you've made that calf and Achilles robust to cope with that. Don't change it. The main thing about injury prevention is trying to not change anything too quickly. So if you were to change from being a forefoot to a rear foot or vice versa, all of a sudden you're going to be loading completely different tissues. And if you're loading completely different tissues, are they robust enough to withstand that load? Because your Achilles can take up to 2 to 3 times your body weight when you're running. And if it's not used to taking that, then again, that's setting yourself up for an injury. So it's thinking about not changing anything and not changing it too quickly. At Treat My Achilles and also in clinic, we do use gait analysis, but these are with people that are injured. And when they're running, we're thinking to ourselves, okay, well, we think what's going on with them. How are they loading those tissues while they're running? What are they doing to make those tissues aggravated or not aggravated? Is there anything we can do to modify those load through those tissues? And then are there any prompts that we can give people? And they may be really simple prompts like, can you run more wide or more narrow? Could you try and lengthen your stride length? Can you look at your cadence, so how many times your feet are hitting the floor in a given period of time? And can we alter those to help offload those tissues? So that's a different scenario. So let's say you've already been to see somebody and you've had a gait analysis session done. It could be a podiatrist, could be a running professional, could be another health professional about an injury, and they've given you advice. Great, stick with that, that's perfect. But again, if you're fine, you don't need to go out and buy that to get, to know what you're doing. What you're doing is just fine. And it's the same with footwear. I shared a post this week by a guy called Brad Beer, and I really liked it. It said, runners should choose their footwear like they would choose a red shoe over a blue shoe.
Yes.
There is no footwear that is the best one. It's all about comfort and it's all about what you know. Yes. And there are certain shoes that lend themselves to certain injuries compared to other certain shoes, but really if you're comfortable and you're happy wearing it, don't go out and spend loads more money on a different type. It's completely fine. So that really is all of my bullet points, and I don't know how to through that, but probably all right.
Yeah, and we haven't actually been kicked off yet, so I think we managed to fix the Zoom thing we had yesterday. Okay, so shall we have a look at some of the questions coming through? Now, first of all, we've got Amy and Dominic saying that brilliant information. Amy's saying, what an informative lady. Totally agree with what you're saying.
Oh, thank you.
Then let me see. Oh, here we go. So Andrew Marsh is saying, I'm a rugby ref and do a lot of running backwards. Yeah, of course. Yeah, kid. I find my Achilles and calf are very painful afterwards, and also occasionally I get glute pain. and I suffer from lower back pain. If we've got any advice for him.
Okay. So you can have an Achilles problem because it's just an Achilles problem. You can have an Achilles problem because other things are aggravating it or masking it and pretending it's an Achilles problem, really. So one of the things that if you've got lower back pain with the Achilles is to have a look at your sciatic nerve, and that might be somebody that needs to do that as an assessment, because what can happen is if your sciatic nerve isn't sliding and gliding up and down your leg as it should do, so it's a non-contractile thing. It's like a piece of rope. It flosses backwards and forwards past all of the other structures. And if anything's tight and holding on to it and it can't slide and glide as easily, then you are likely to get tightness and pain. And if you think about the path of least resistance, where's it most likely to be tight? Probably nearer the end of that movement, so that's your foot and your Achilles. So it could be that you might have tight muscles. It could be that you have some weakness somewhere. It might be that there's a bit of stiffness in your lower back. And they're the sorts of things that an assessment would look at to help you with.
Yeah, so Andrew, I don't know if you've just joined the group this week, but I did a talk last week about recurring calf strains and spoke there again about neural tension, and they because that's one of the problems that we see with calf strains that often happen. And I demonstrated the slump test there, how you can easily test even via video if you are tight in your nerves. But I would definitely, I would look at, are you doing flexibility work on a regular basis? Because often the reps are quite good with warming up, but are you actually good with stretching things out after you've done it as well?
Mm-hmm.
Okay, so then Amy's saying that she's also getting back pain or lower back pain as well. Yeah, so again, Amy, I would say the same as Ali has just said. If you're getting lower back pain and you're getting Achilles pain, it can be two different injuries, but it can also be one injury. And it is one of the standard things that we test for when we do our assessments at treatmyachilles.com. So whomever you see for that should be testing both of those things as well for you. Now, Joanne is saying, as well as my Achilles, it also hurts to the right of my foot under the ankle bone. Is this area related to the Achilles pain? Now, Joanne, the right side of your foot, it really depends on which foot we're looking at.
Yeah, it could be outside or inside, couldn't it, really?
Yes.
Yeah.
In your experience, Ali, if you've got pain on the outside or inside of your foot and you've got Achilles pain?
I guess it depends how close to your Achilles it could be. If it was within close proximity and you could feel it and then feel right next to your Achilles, then there could be a link, because you've got other muscles that come down there, and some people have one of those muscles called the plantaris muscle and other people don't. And if there's a single spot that you can put your finger on, sometimes and that's tender, then that might be part of the Achilles problem and therefore needing an assessment to find out. If it's more wider than that, you've got other tendons. So you've not just got your Achilles at the back, you've got other muscles that come down the side of your shin or the front of your shin, and they come around the ankle bones, those bony bits that you can feel on either side of your ankle. And again, they may have an overload issue. So if you've got an Achilles problem, you're loading them to compensate for it, and it could be that they need looking at too. Or indeed, the problem might not be Achilles at all. It might be one of those other tendons.
Yeah, so Joanne's come back and said it's the right foot as she's looking down. It's on the right side of the foot.
So more lateral.
Yes, so I guess that could be peroneals.
Peroneal, yeah.
And other tendons we'd want to look at.
So your peroneal tendons run down the shin on the outside and they pull your foot out to the corner. So there could be similar loading issues, but it would be a different set of exercises and the different things that you would look at for that.
Yeah, and I guess it also depends on how your Achilles pain started, because depending on how your injury came about, you could have strained both the Achilles plus those muscles, especially if you were running at an angle and a long race or something like that, or you went over on your foot. So yeah, the one can be, I don't think the two are directly related, but it could have come at the same time. Okay, so I think we've answered all the questions. If I've forgotten somebody's answer or question, then please forgive me and shout at me by tagging me in there, and I'll get back to that later. But yes, as I said, if you're watching this on replay, please tag Ali or I if you've got any questions. And then, Alison, so thank you so much for coming
No
on to this tonight. It was really useful.
Well, thank you. Thank you for having me.
And yeah, guys, if you want any advice or any more help with Achilles problems specifically, check out our website. We do everything online. It's via video calls, so it's just like tonight. We can have a full-on interview with you and then get you to do all the test movements in front of the video. We can even do gait analysis or analyze your running style if you film it for us on a treadmill. So have a look at that and let us know if you've got any questions. All right, take care, guys.